I'm just going to say it's already 3 minutes after. We should probably just go ahead and get started. So I wanted to say welcome to everyone. Thank you so much for coming. Again, we will record this so that we can share it with our other students when it's not such a beautiful day in Boone. So thank you. And I'm going to leave it off to Adam. I'm going to let you go ahead and get started. Adam Heggie is our professional public health expert here on campus. Favorite of all of our students. My students I meet with always talk about how much they love working with him. So I'm really thankful for him to be here today. Thank you.
Well, thank you, JP. I'm glad to be here with you all. I get excited about public health, healthcare, social services, all of this. So I'm excited to spend some time with great professionals today and hear from them and be able to share this with our students. I wanted to just kind of give my little quick spill of the healthcare system and public health, just to get us thinking about these things. I know that we'll hear from Dawn and Caitlin and Megan a lot about this work, but in public health, we use what's oftentimes referred to as the stream analogy to describe health and our healthcare system. And some of you may have heard it before, but I'll just share it real quickly again to get us thinking about some of the things I'm hoping we get to talk about today. So the image is you're with a group of people, a group of adults, and you come across a stream in the woods and you see kids being swept down the river. And so some of us instinctively go jump right in to try to save kids. That's who we are. We're people that want to jump in, save kids. We want to do those immediate things. Some of us want to go down to the bottom of the stream, to the end of the stream, and catch kids as they come over. We want to save them in that mechanism. Some of us like to go upstream. And so we like to go up to where kids are being put into the river. How are they getting into the river? And so when we think about our healthcare system, it really functions that way. And so we're going to hear a lot about that in a lot of different ways today. So public health and social service workers, healthcare workers to some extent as well, we are upstreamist. We are upstream and midstream people. We want to address things, prevent things before they happen. We want to be involved with the social aspects of health, social determinants, and all of the elements that contribute to health. We need our healthcare providers. We need those people that are willing to be the people that catch and be the people that treat. But as you think about our healthcare system in general, we focus a lot of our attention, our money, our resources on the downstream effects. We're not very successful here in the United States. That's safe to say. And a lot of it is because of our attention being focused downstream. So I'm hoping today that we get to hear from some great professionals that will really, I'm sure, in some aspects, bring that into their work in terms of public health and social service. So I'm excited to be with this group. So I'm going to get us kicked off and learn some about our great panelists today. So my order on my screen is Caitlin, Dawn, and Megan. So I'm just going to kind of keep that order if that works for you all. We might switch it up some along the way. But so the first question we have for you all, and we'll just start with Caitlin, is could you tell us a little bit about your organization that you work with and what your role in that organization is?
Absolutely. So I work for Youth Villages, and we are a national nonprofit mental health agency. So we are located in 14 states across the country, and I am in North Carolina. And in North Carolina, we have 13 locations across the state, including one there in Boone. And our focus is working with kids who have those extreme emotional and behavioral health issues. We see a lot of the anxiety, depression, a history of trauma. We see a lot of those external negative behaviors, whether it's truancy, runaway behaviors. And then we also have a program working with young adults aging out of the foster care system. So helping them make that transition into independent living and really providing them with those skills they need along the way. And in North Carolina, our focus is providing that community-based service. Rather than making them come to us, we go to them. And we are literally and figuratively meeting them where they are to really create that change for the youth and their families or the young adults themselves. So I'm a recruiter within the state. So I find the individuals who provide that counseling and therapy to the kids and families and the young adults at the same time.
Thank you, Caitlin. So Dawn, if you don't mind going next, if you can just tell us about your organization and your role.
Well, hello there. I work for a rural health group, and we have, I think, currently 15 clinics in northeastern North Carolina. We have clinics in about 5 counties, I think. Rural Health Group is a federally qualified health center, and so we do provide primary care, but we do so many other things because in rural communities, you don't have a lot of private practitioners. So we see uninsured as well as insured patients. The federal government does give us funds to care for the people. And we do more than just primary care. We have social workers, we have behaviorists, we have dental clinics. We have a quality team, and they spend a lot of time looking at the data to see, are the people taking their medicine, so on and so forth. We rely heavily on studies of social determinants of health. And so there really is an intersection between social services and healthcare right in our clinic. Some people accuse us of trying to be all things to all people, and we really can't be, but we are doing the very best that we can. My role, I'm a registered nurse for the clinic, and I have served as a practice manager. Before that, I was a panel manager, and what I did was kind of go upstream and look and see what's going on with people and try to, make sure they got geared to the right provider for them and things of that nature. Now I serve as the ACO care coordinator, or one of 4 ACO care coordinators. And I do Medicare wellness visits with people who receive Medicare, just to make sure that we're doing everything that we can to give them the best possible health care. And right now, because of COVID, I've also done a lot of testing, and right now we are vaccinating people. So I'm actually sitting on the campus of Halifax Community College, where we have a vaccine clinic, and we have our Department of Public Health and our clinic and EMS all working together to make sure that we get as many people vaccinated as possible.
Thank you, Dawn. I appreciate you sharing that. That COVID is a great example because, thinking we need the nurses, we need the practitioners that can get needles in arms, but we need all of those other people that are able to manage and organize things and focus on those other things. So it takes that whole kind of system working together. So thank you. And last but certainly not least, Megan, if you don't mind sharing a little bit about yourself and your role.
Yes. Hello, my name is Megan, and I work for a national nonprofit called HealthCorps, and we were founded in 2003 by Dr. Oz. And going to Adam's analogy at the beginning, which going upstream, Dr. Oz found that through his practice, he was seeing students youth younger and younger coming to him with obesity and heart disease and a lot of chronic diseases. And so he launched HealthCore in an effort to impact teenagers and really empower them and give them the tools to take charge of their health when they are at an age where they're finally able to start making decisions on their own. And so we work primarily with high schools around the country. We've served in hundreds of schools since 2003. And our main focus with the schools that we work with are on nutrition, physical fitness, and mental resilience. And so through our programming, we partner with our schools. And we have a coordinator who's placed in a school full-time, and they partner with teachers to implement our curriculum. They host student leadership clubs to really empower the students to encourage their friends and their peers to take on their health as well. We have community-wide health fairs, some staff wellness events and challenges. It's a really wide range of programming that can be tailored specifically to the need of the students and that individual school. My role with HealthCore, I've actually been with HealthCore for about 7 years now. So I started off as a program coordinator myself, where I worked in a high school for 2 years, and then I have continued to move up within HealthCore. I served as a supervisor, being able to support our coordinators on the ground, implementing their program, and now I'm a program manager, where I oversee training, development, and culture of our core as we really look to provide professional development opportunities to support the growth of our coordinators, who tend to be recent college graduates, as they go on to other careers within the medical and public health field.
Great. Thank you, Megan. I appreciate that. Sounds wonderful. All right, so I'm going to go to our second question. We want to learn some more about you all this afternoon. You're right, Deanne. This is a great panel. I'm excited about this. So we want to hear from you all. How did you get to where you are today professionally? Like, what set you up for where you're at today, and what are some of those key steps you took to get to where you are today? So we'll rotate back around and we'll go back to Caitlin with that one.
Yeah, so I am working for a mental health agency, obviously. I came into Youth Villages actually knowing nothing about mental health. So I was put through boot camp essentially to learn the ins and outs and the expectations. I learned terms I never knew before. Now I know enough to be dangerous. I can really explain the steps that people need to take or should take to reach a certain point in the mental health field, social services, human services. I learned way more than I ever thought I would. And I got to this point just by talking to our staff because they are the experts. Whether it's an MSW working and providing that trauma-focused CBT, whether it's the marriage and family therapist who I'm learning something new from, I'm always the one who's asking questions because I don't like not knowing things. And getting into Youth Villages, I'd been in recruiting for a while and I wanted to work for an organization that did something. And I learned about our Life Set program, which is the one that works with young adults aging out of state care, foster care. And I said, the fact that there's a company that recognizes that challenging time, not just that age range, but anyone who doesn't have support, I said, that's the company I want to work for. So 5 years later, here I am, and I am able to share my knowledge with other people to figure out what would make the most sense for them, help them understand how the work that they're doing impacts individuals. And kind of in that way, by being able to hire the best staff, I'm making a roundabout influence as well. So just continuing to learn and grow and understand what's necessary in the mental health field has really helped me get those best hires for us and really learn more than I figured I'd ever know about mental health.
Great. Thank you for sharing, Caitlin. That's great. I think you really talked a lot about that continual learning and that learning never stops. And I think that's vitally important. Thanks. Dawn, I'll go to you next.
Okay. Well, I have a little story to tell. I think I'm a little older than the other panelists. And so it started when I was a little girl. I always said I wanted to be a doctor or a nurse from the age of 5. And I went through school and I was, on that path. I was even my senior year of high school looking for colleges that would allow me to have my own cadaver because I was going to medical school. And somebody asked me, well, what kind of doctor do you want to be? And I was like, I really don't know. And so it was recommended that I do some study and determine what type of doctor I wanted to be and what steps it was going to take to get there. And so by the time I got done looking through everything, I'm like, man, it's going to be 4 years of undergrad. And then I got to go to get my graduate degree and pre-med and internships and residency. I said, my God, it's going to be 12 years before I have a return on my investment. So I kind of chickened out and I didn't go to medical school. What I did instead was I got a degree in business management from Rutgers University. And I worked in all kinds of business operations. I was a customer service manager for a while, got really involved in the technical end of business and just all kinds of exciting stuff. And then I moved to North Carolina, and my business degree did not really help me living in the small community because I wasn't related to anybody. Nobody really knew me. So it's really hard to break into business. So I did get a job in the business department at the local hospital. And I was working to help people pay their bills by getting them set up with services like social services, Medicaid, charity care, so on and so forth. And I did that for about 3 years when I realized that there was really something more that I could be doing for patients than just getting the hospital paid, because that, in essence, is what I was hired to do. And so at the age of 45, I went back to school and I became a registered nurse. So fast forward, the local clinic and the hospital formed a partnership, and they thought it would be a good idea to open a clinic in the hospital to catch those people that always come into the hospital to the ER for their primary care. And we figured if they could get to the ER, they could get to a clinic that's in the ER. And that is how I started where I am now. So it's been a pretty interesting journey, and I've done some other things like work in a prison, and I was a radio personality for a while. So I've done a lot of things to get where I am, but back to where I started from the beginning. I said I'd be a doctor or a nurse, and here I am.
Wonderful, Dawn. Thank you for sharing. Wow. Megan, we'll go to you next.
Yeah, so similar to Dawn, when I was growing up, I always, enjoyed and excelled in the sciences and figured, okay, I'll go into a career in medicine. And it wasn't until I got to undergrad where I started taking my science classes, and I was like, I'm not sure if this is for me. And I learned of public health, and I had never really known what public health was until I think my sophomore year of undergrad. And as soon as I heard of it, I was like, yes, this is exactly what I want to do. I'm so interested in being a connector within the community, and really gravitated towards the preventative side of health. So I went to the University of Michigan, where I graduated with a degree in psychology and gender and health. And after I graduated, I started with HealthCorps as a program coordinator. And I went into my 2 years of service with HealthCorps really thinking, this is a great opportunity for me to get a wide range of experience and actually serve the community and be able to learn so much from the people that I'm working with. And then after that, I will be able to go back to school, receive my master's in public health, and continue, to grow within my career. After my time with my coordinator, I just continued to grow within HealthCorps and didn't end up going back to get my master's. It's something that's still in the back of my head. But I think something that set me up during my time as a coordinator to just continue to grow professionally is being open to any opportunity that comes my way and just say yes. Early on in your career, I think that's something that's really important, is to kind of keep your options open. And if something presents yourself to you, even if it's not, something that you are immediately interested in, just say yes, give it a try. You're going to learn so much. One example is after my first year as a coordinator, I was asked to support at our national training and be a mentor for the next group that was coming in. And it would require spending, about 6 weeks in the summer in Houston. And I was like, this sounds not enjoyable at all. Probably 90% humidity, 100+ degrees. All my other fellow coordinators have the whole summer off, and I wasn't too keen on it, but I did it. And I think that really showed that, I'm invested in this company. I'm willing to be a leader and step up. And it's, continued to open many more opportunities for me. Another thing that I think has been really helpful throughout my career is utilizing community partnerships and connecting with other people within the community, because you never know, what resources and opportunities may come from that. And when I was a coordinator, I was in Oklahoma City, and I moved there. I didn't know anybody prior to starting, but through the community relationships, I was able to grow and expand my program so much that I wouldn't have been able to do by myself. And so just realizing that you as a person can only do so much, and it's okay to ask for help and really utilize the partners that are available to you. And now that I'm in more of a national role where I oversee program on a national level, understand the importance of partnerships even more. Whereas we look to grow and expand into different sites, those connections that you make with people, carry them on with you throughout your career, and you never know, when they're going to be able to come back and continue to support your efforts. There's a lot of people out there that are doing similar work in the public health field, and if we can connect with other organizations doing similar work, it'll benefit everybody and ultimately benefit the population and the people that we're serving.
Great. Thanks for sharing, Megan. That hearing Megan and Dawn back to back, it makes me think of, we go to college for y'all students, and we think we're going down one track, and we don't always go that track. And I think what we've learned from both of them is that be open to change, be open to experiences. Everything kind of adds up and leads to who you are as a person and professionally. So that's vital. So thank you. All right. So next set of questions are kind of getting at, what are those challenging aspects of your work, but at the same time, what are those rewarding aspects of your work? So if you could just talk about that. I'll go to Caitlin first.
So I'll say for me, the most challenging aspect is finding that pool of qualified, dedicated, and willing employees. The social work field is a very difficult one, and it takes the right person to want to do the work and to have the heart to do it. So especially in some of our rural areas, there in Boone, out in the further west, out in Greenville, we only have a finite number of candidates who are qualified to do the work and who are willing to do the work. So being able to connect with those individuals, going back to connecting with partners in the community, being able to really convince them that the work that we're doing and the organization is the one for them and this is the right fit for them is really the most challenging aspect. Really getting that right fit is incredibly important because it's not for everybody. There are so many different versions of social work and mental health that there is the right fit for everybody. So what we're doing might not be for that one particular person. So being able to really hone in on what that person looks like and what their passion is. But once you find that person and can get them into the role, I think that's obviously very rewarding for us, but knowing that they are creating that change for these kids and families, and then really seeing those who stick with us and you see them grow in the organization, whether it's into leadership or into a more support role where they're affecting change in another way, they're growing our contracts, being able to see that kind of change as well, where you can say, hey, not only have they helped kids and families, they're helping the rest of our organization. I got to be a part of that, and just seeing that growth for an individual and knowing that that you found the fit for them. I think that's the most rewarding part of my job, just being able to see that long-term commitment and connection.
Thank you, Caitlin. And Dawn?
The most challenging aspect of my work is because we are in a rural community, we just don't have a lot of the things that maybe a Wake County or someplace like that has. We don't have all of the services. And so our clinic is, like I said earlier, people tend to think that we're supposed to be all things to all people. And we would love to be, don't get me wrong, we would definitely love to be. We don't have broadband here in most places. People have issues with transportation. We don't have any public transportation here. So just being able to serve the people that we're supposed to serve the way that we want to or would love to is a challenge. And so we have to be really creative. And so I guess the most rewarding part is we get to think outside of the box and we get to try different things. We're doing PDSAs like every day and trying to find out how's the best way to handle this. And I know for sure that COVID has provided us with some challenges, but also opportunities to really get our creative juices flowing and try to figure out how we can best do all those things that we know that we are called to do and that the government expects us to do. So that is a reward. And we have had a few, I want to say, wins in terms of dealing with this whole pandemic situation.
Thank you, Dawn. And Megan?
One, I think the biggest challenge working with schools is that they can be a very difficult and political environment, and our coordinators aren't employees of the school. And so that just kind of adds to this dynamic here, which can create some challenges. And then also the schools that we work in tend to have a lot of need, and what the coordinators are seeing on a day-to-day basis is, especially this past year, of students who don't have access to food or are homeless or have really, really difficult situations that they're dealing with, and us going in and, encouraging them to, build a balanced plate and make sure they're including fruits and vegetables into their diet can sometimes seem a little bit disconnected. And so over the past couple of years, we've really noticed an increase in both interest from the students as well as from the school administrators that we work with to focus on our mental resilience pillar and give the students tools to overcome challenges and hardships and understand how to deal with some of the difficulties that they are facing. So that's certainly something that's very difficult. Also, working with teenagers can be tough. You know, in a class of students, you might see a bunch of blank faces and not think anybody is listening to you. But one thing that I always encouraged my coordinators to do when I was a supervisor was to instill to trust the process and realize that change takes time. And working with somebody, it's not like they're going to just change their behaviors overnight, but over the course of, you know, the couple of months in the school year, by the time you're working with them, they will start to change their behaviors, and they are listening, even if it doesn't appear that they are. You know, there's times where you would be working with students and you thought, you know, this was the most disengaged student in the classroom, and 3 months later they came and visited me in their office for office hours and, you know, opened up and implemented these changes that they were able to take home back to their family. So I think that was the most rewarding part, is once you do work with these groups of students for, you know, an extended period of time, really hearing the change that they make in their lives, not just within themselves, but within their peers and within their families, and knowing that the work that you are doing is having an impact, even if that impact isn't immediately realized.
Thank you, Megan. Thank you. So I'm hearing, I think, some themes I heard come out of all three were, you know, like Megan kind of ended, sometimes you may not be realizing you're making an impact. So I think about it with college students as well, but also think about like people, everyday citizens that you all work with. You know, sometimes you don't always see it, but it happens over time. Those types of things that happen. I heard a lot about creativity, evolving. I loved how Caitlin, I think, kind of presented as seeing the big picture, seeing where you fit. And Dylan related that too, that we can't do it all, but we have to understand the whole system and see where we fit and where we're most utilized. So I think those are all great. So thank you all for sharing that. All right. So the next question for you all is, what does the future look like for your organization? Obviously, organizations are having to evolve, they're changing. And how has COVID-19 impacted both the current and future? So kind of share anything you have related to those.
So I'll start by just saying how COVID-19 has affected just current especially. So obviously, as a community-based organization, our staff are typically going into the homes of families. They're going into schools. They're going into meetings and sessions with social services and juvenile justice. So that all came to a screeching halt about almost a year ago. Our IT department did a really phenomenal job catching us up and getting all of our staff set up with telehealth so that we could continue sessions virtually. We made sure all of our families had the necessary equipment, whether it was internet, laptops. We made sure the young adults that we worked with had enough data on their cell phone plans so they could still do sessions. And we really adjusted as we could to provide the virtual sessions. And you can get a lot through virtual face-to-face, but we did have to shift some too, because some of the kids that we were working with, whether their age or even just their behaviors, weren't conducive to doing it virtually. So our counselors and our specialists all got really creative and would go to do home visits, and they would mask up, they would socially distance. During the spring and summer, it was especially easy because they could be outside, so that they could have that space. And I've seen them adjust that through the winter season, making sure that they are continuing to have that contact. I know they've sat outside in the cold weather. They've had 8 feet between them and a family's home. So they're essentially yelling at each other doing these sessions, but doing it in a productive way. So I've just been really amazed by how our counselors have shifted to doing what they need to help these kids and families. It's been really cool to see. And as far as the future, we are continuing to grow, especially here in North Carolina. The state has started to realize a lot of what we're doing is working and it is having an impact and keeping kids in the home and keeping young adults on track to that successful adulthood. So we've gotten several new contracts across the entire state We're growing across the country, and I think especially with events over the past year, there's more of a focus on mental health. And I believe, like you said, catching them at the beginning of the stream and really providing that service before it's a crisis or before it's an emergency. So being able to see that happen and have more of an emphasis, especially during a pandemic, has been tough, but really cool to see happen for us.
Yes, I think mental health is, all of us have a connection with mental health. Mental health is going to be one of those challenges that we already had that's only going to be worse as a result of COVID-19. All right, Dawn.
Okay, so for our organization, just like has already been said, a lot more virtual visits. We were trying to do telehealth for years before COVID hit. And we tried to do it with some, I guess it's outdated equipment now. And we would take that equipment to the patient's home, and the doctor would be in the office and the EMS worker would take the equipment there. But the problem often was that the person just didn't have any broadband in that area. And so that would fail. And so when COVID hit, we could start doing visits over the telephone. CMS, the Centers for Medicare and Medicaid Services, was not paying completely for those telephone visits as much as for they wanted to see some kind of face-to-face. And so we've got an aging population, and again, it's a rural community. People didn't have things like smartphones to do face-to-face or FaceTime. So we got a little creative, and we would have people that just couldn't do it at home just come to the clinic and sit in the parking lot, and somebody would bring a tablet out to them. But then some of the older people, they started saying, well, I need one of these smartphones, and they would get their grandkids to teach them how to use it. And so I think that the future of the organization is really going to be what we wanted all along, which is to be able to do more telehealth. And for some of our patients, they can't leave home, and so they can still have their visits now. That's a wonderful thing. I think COVID has impacted the current that way, and it's going to be in the future. And we also have behaviorists, and so they're doing their behavioral health visits that way. Pretty much anything that's not going to require being touched can be done virtually now, and that's going to be able to free up space for people that have to come in the clinic. I think it's going to cut back on overcrowding. And I just, I hate that COVID happened, but I love some of the things that have come from it.
Yeah, thanks, Dawn. I appreciate that. Yeah, I think for us in public health and social services, COVID has been tragic and terrible, but I think it has taught us a lot. And so it gives me some hope for moving forward, hope for the future of things that we've learned and things that we can be doing. Megan, we'll go to Megan next.
Yes. So here at HealthCorps, we actually had new leadership come in last January. So we had a new CEO come in, and I mean, talk about a difficult time to come in and take over a company. But I think a lot of the changes we've seen in the last year are a mix between, one, having new leadership, and two, the impact of COVID. So working in schools almost overnight last March, all of a sudden, all of our coordinators were working from home and needed to find ways to continue to reach their students in their school. And what it looked like in the spring was a lot more service and going out into the community and involving in some, food distribution sites and finding ways to still reach our students with our resources, a lot of through, those food distribution sites. We also have had a lot more products that we've created digitally. So we have, lessons that have been created on our website that are distilled into, a 5 to 7 minute video that anybody can watch with some associated resources. And so that's one area that I think will certainly continue as we look. It's allowed us to reach more and more students across the country. Another thing that we realized is meeting our students where they're at. Where are they? They're on social media. And so we have created some teen-focused social media channels to get our resources, get our information out to the teens and really directly engage with them. So that's been a big success, certainly something that will continue. Another thing that is pretty unique is that our students, they typically just work within their school and work with their peers at their school. because everybody has gone virtual, it's also allowed for some cross-school connection. And so we've launched a National Wellness Council where teams from schools in New York and rural Oklahoma and LA and Texas are able to all come together for these national events and learn about what's happening in their communities around the country, and also connect with one another to see what work they are doing. So that's been another really interesting that's resulted that will continue to stay. And then the last thing that I'll touch on is focusing on connection. And so going back to our pillar of mental resilience and mental health being an increased focus, certainly this past year, but really the past 5 or 6 years, is we have launched a new program component called Teens Make Health Happen. And this is essentially a club where teens can come and learn about their own personal health and go through a journey on their own health, while also creating some community impact projects based on the design thinking model, where they can then implement a community project in their community to create lasting change. And so the hope is that through these clubs, they're going to feel more connected to their peers, as students are feeling more isolated than they ever have before. And then that's also going to help HealthCorps scale and be able to reach more and more communities. So again, some of those are specific to COVID. Some of them are a blend of COVID specific and new leadership. But over the last year, we've really had a lot of exciting programming that has resulted from COVID, had to think on our feet and adapt quickly. But looking back on it in the past year, I think we're really proud of how we were able to adapt and still find ways to reach our students and our communities.
Great, Megan, thank you for sharing. I think that's great for me, thinking about the way that we're able to connect with people more broadly, more widely, innovatively, I guess you could say. I mean, our ability to connect with other professionals around the country, around the world, it's amazing. I'm thinking about it from a professor standpoint, the guest speakers we can bring in now, that who would have thought we could, bring in, some of these big name people in the field. And so it's just exciting time in that regard. So thank you. So the next question I have for you all is, so I'm going to kind of preface this, exciting for students, and we share this with our students here. We're in the early steps of hopefully developing a Master's of Public Health here at App State, and public health and social services are the big thing. I mean, they're the professions growing. I mean, if you look at the Bureau of Labor Statistics, it's not even close how far ahead they are of other professions. So you're going into the right field, students. So have that hope. So with that being said, and COVID has helped us spur that on as well, what do you think lie ahead for our professions moving forward, like your profession in general?
I think, for one, I think social services in general, and obviously public health, healthcare, I think there's now more of an appreciation. I think that in light of everything happening, I think that people are really starting to understand that we do need these people. We do need these healthcare workers. We need these social workers. We need the counselors, the therapists, because they're providing that essential service. And seeing that firsthand, I think, is the worst way to have to learn that, but is necessary at times. And I think that it's going to really see a growth in the field itself, and see those individuals who say, hey, these people are finally getting the recognition that they deserve, and understanding that this is an essential need. And I think being able to see that happen is, again, in a pandemic, the worst way to do it. But I think it's exciting to see that the appreciation is growing, and being able to be part of that and help guide people into understanding this is really, really exciting to see. So I think that social work, especially in the mental health field, has some good growth happening, and I look forward to seeing more of it occurring in the next several years.
Thank you. Dawn?
Well, what I see here is that social services, healthcare, public health are beginning to work more together because we've had to. Like I mentioned earlier, I am sitting here on the campus of a community college where I went to nursing school, by the way, in a clinic that I work for, because we have school-based health centers, and the Halifax County Health Department. They're the ones that are actually administering the vaccines, but they realized that they didn't have enough staff to do it the way that it needed to be done. And so we've partnered together. We've got EMS here that are watching the patients. They get 20 minutes after they get the vaccine to make sure they don't have symptoms. And so we're learning that we have to work together. It takes all of us to get the job done. And so after we found out how important each part is, and we see that because of everything that's been uncovered recently, and we know that there are so many social inequities and healthcare inequities, and now we're having to deal with them. It's going to take us working together to do it, and that's what I see moving forward, is that we're no longer going to be working in our silos as we were before, but we're going to be coordinating so that we can give our community that we serve the best possible care in all aspects.
Thank you, Dawn. I appreciate that. I teach students that way, that river analogy. We need people in all of those places. We need all of those people, but we need those people working together and all working systematically together. So thank you. And Megan?
Yeah, I think, just since I've graduated my undergrad, I have, when I was an undergrad, learned of public health. There was no major public health. And, University of Michigan has a wonderful master's program, but there was very limited specific classes and programs that were available to me when I was in college, 8 or 9 years ago. And just in those, short years, they have developed an undergraduate program where I think that just speaks to meeting the need, and more people are interested in going into this field. And so there's more opportunities for it. And same with a lot of, certificate programs. I think that there's a lot more opportunities out there. About a year or two ago, I got a integrative health coach certificate through Duke. And, it was, okay, I might not be ready to completely go back and get my master's right now, but there's still ways to further your education. And again, just meeting the need, there's more opportunities over the last 5 or 6 years. And then also, I think wellness is just becoming more talked about, and it's something that more people are interested in. Thinking back to when I was in high school, nobody talked about mental health. I don't know. It was just like a taboo topic. And it wasn't that long ago that I was in high school. And so now that it's becoming more common and mainstream, I think people are realizing the importance of it, and realizing how connected your health and public health is to other areas of life. So like Dawn mentioned, social inequities and how health in certain communities plays a role into those inequities. And because of that, people are willing to invest and put resources into the public health field. So I think with just everything that's happening in the world, with wellness being, a more popular topic, it's just continuing to grow, and I'm excited to see where it continues from here. But I think it's a really exciting field to be in right now, as more and more people just realize the need and want to be a part of it.
Thank you, Megan. I appreciate you sharing that. So we're proud of our undergraduate public health program here that I get to serve with. We were one of the first undergraduate programs in the United States that was a standalone. We don't have a school of public health. We don't have a medical school. So we're taking a backward approach to how it's typically done. Usually they have master's programs and they work their way back. So we're reinventing the wheel, I guess, as it comes to that. So yeah, I'm glad you were able to share that in regards to public health as a field, seeing the needs as well, and understanding that things that we can teach at the undergraduate level can be applicable right now. So thank you. And our last questions to hear from you all. If you had to give advice to current undergraduate students in 2021, we're in the midst of a pandemic. Hopefully we're getting close to it being nearing toward the end, maybe, knock on wood. What would it be and why? What would be your advice?
I think for me, kind of echoing what Megan said earlier, say yes. If you are presented with an opportunity to job shadow, to do an internship, to gain some sort of experience, I think saying yes can be one of the scariest, but also one of the best things that you can do. especially given the fields that we're all working within, it can be incredibly difficult. So kind of having an idea of what to expect before you dive in can be really great. You can, try to find places to shadow, try to find places that will let you ask them a million questions, because being able to do so would really give you some insight and really allow you to know what to realistically expect. But I think being able to say yes to opportunities that are presented, like I said, even if it scares you, can be one of the greatest things that you can do, and that can really help set you up for success. So I think that would be my biggest advice.
I guess my advice would be just make sure you know where you think you want to go, because as I told you, you might end up someplace entirely different. But explore, try to know as much as you can, and don't just stop with whatever your coursework is, whatever that study is. Go even beyond that to really learn. Like if you're coming to work in a rural community, you need to know that it is totally different than living in a Raleigh or Durham. There's a whole lifestyle here that is there's a culture, it's completely different. Know the area that you're going into, and just know that if you are in a field that you love, it's not work. And it can, it could set you up to enjoy your life. It's not about how much money you make, it's about the difference that you make and fulfillment that you get from whatever your selected course of study is.
Yeah, I mean, I completely agree with everything that Caitlin and Dawn just said. I think to add to that, I would say don't be afraid to ask for help. I think a lot of times it can be scary and think that you are, wasting somebody's time if you reach out to them and ask for help. But people genuinely do want to support you and help create opportunities for you and for your own growth. And as we look at, this year specifically, people realize that it's difficult to be a college student right now. It's difficult to be in the position that you're in, and you're not going to, you won't know, what missed opportunity you might have if you don't ask for help. And, if people are in the position where they are able to, provide a resource, and whether that be an internship or shadowing or, a job at the end of the year, they're going to support you. And if they can't, they might be willing to connect you to somebody else within the field. So, I mean, nothing bad can come from asking for help. It can be a little uncomfortable at times, but I think it will open a lot of opportunities, and you'll realize that people, generally do want to support the growth of, our next generation of workers as you get ready to enter the job force.
Yeah, thank you. Thank you. Yeah, I think a common theme I heard across all of those, I think to some extent, was don't be scared to be uncomfortable. Get out of your comfort zone, whether it be in terms of the environment, the people you surround yourself with, get to know people that have had different experiences than you, life experiences. I think that's always vital. So thank you all for sharing. Do we have time for questions from the students? I think Kate had a question. So Kate, do you want to pose your question, or do you want me just to read out what you put?
Can you hear me?
We can hear you. Yep.
Okay.
Good.
I just asked, obviously COVID kind of changed everything, and you're moving a lot, trying to stop, or I guess, were you just trying to plug the holes in a leaking ship, or did you widen the gap?
It's a great question.
I don't know if that made sense, but
I think that it brought to light a lot of things that the public health field were facing that the general public might not have realized. And so as we look at a lot of these issues, and going back to the example I shared about students not having access to food, that's always been an issue. And yes, it might have been heightened this year, but more and more people are realizing, there's a lot of people out there that need the support and, need to go to school in order to get their breakfasts and lunches. And so I think if anything, it's just highlighting some areas where work can be done. And because of that, more people are educated and aware on, some of the public health issues that our country is facing, and, willing to provide resources or support to, help address those issues.
I agree with Megan. I think we were plugging the holes up before. I think now we're actually making some repairs. At least we know what repairs need to be made, and we are working towards that.
So I'll just throw on top of that, and Caitlin, you may have further that you want to. I just, I think both of them, what they reiterated is that these were things in public health, social services, healthcare. This is not new to us. We knew this was happening. This was just the opportunity, I guess, for the general public to see it, see what we've known for years. And so my hope is that it leads to culture change, that it leads to social change, all the things that need to happen. It's not going to happen overnight, but hopefully, I don't think we can escape it anymore, hopefully. And then for that reason, I'm excited about it. Any other questions or comments or thoughts?
As a staff, I'd love to just add something to reiterate what the panelists have shared today for our students. Just prior to this, I happened to listen in on the listening sessions that Appalachian's doing about our gen ed, and those critical thinking skills came up, as a goal. And so it was so interesting to come from that meeting to this one and see and hear examples of how these panelists in 3 different types of organizations have had to think critically with their colleagues, within their organizations, outside, solve problems, be creative. And I think public health is very multidisciplinary. And I hadn't thought about that as much until just now. And so, to the students, I think if you are public health, wow, what an incredible and timely discipline. But, you can think it broadly about these skills. And so to capitalize on what Caitlin and Megan and Don were saying, and Adam, find the challenges, embrace them, solve those problems, get creative, and hopefully you see that no matter what you study, those skills are utilized and they're needed. But man, what a great discipline to have, and what a great field to be going into at this time. So I guess that's just a little bit of a plug both for gen ed and the specific major of public health. If a student needs that right now, with remote and virtual learning, just dig your heels in a little bit more, hang in there with us, and just keep smiling. We're all, those of us at Appalachian and those in the professional world, we are here for you virtually and, as close as we can be physically to support you now and in the years to come. So just a little encouragement for them.
Thank you. Yeah, it makes me think yesterday, Deanne, we had a small college group yesterday of faculty and staff in our college, health sciences, and we were talking about, how we train our students. And we've got to rethink how we train our students. And this really reiterated it for me today, that we still train our students in their silos, as Dawn mentioned earlier. And we still have to do that to some extent, but we're going to have to figure out in higher ed how to teach students the way the real world works. I mean, they're going to be solving these complex global challenges. They're not going to be solving it from just their discipline. They're going to have to learn to work with others. And, me being a public health professor, I get excited about that because that's what we do. That's who we are, whether we always like it or not. I mean, I tend to like it in terms of having to think about who all we have to work with. But we in public health are so multidisciplinary that we're not a discipline in itself. We're just a bunch of disciplines that come together, I guess you could say, in a lot of ways. So. Any further follow-up questions? Final concluding thoughts? I think that's all I have. I don't have any further questions.
Well, I would just like to end by saying thank you so much. Megan, Caitlin, John, thank you for being with us today. And we really appreciate your insights and your guidance and encouragement to our students. So this was a pleasure, and we hope to have you back again sometime.